Hi, everyone. Welcome to the State Recipient Office Hours. We'll get started in just a minute. All right. Hi, everyone. Thank you for joining us today. My name is Natalie Metzger-Smith. I am a technical assistance provider with TAC. And today we are going to spend the next hour with each other for the State ESG Recipient Office Hours. Next slide. All right. I know many of you have participated in these webinars before, but just as a reminder, the slide deck and a copy of the chat and Q&A content will be shared with you all within the next few business days. And then if you are unable to attend this webinar or have been unable to attend any previous webinars, you can always find copies of the recording and the meeting materials on the archive, which is on the HUD Exchange. If you go to programs and then the ESG, and then there's an ESG-CV section. If you click on that, you'll be able to access the archive. Next slide. As always with these office hours, I want to start with a few announcements. Some of you may have received the resource roundup that was sent out this morning, but I wanted to highlight a few upcoming trainings. The first one is actually today, right after this office hours. The National Alliance is hosting the Framework for an Equitable COVID Homeless Response is hosting a webinar at noon Pacific time on how to incorporate lived experience into the homeless system. And then I know many of you have gotten reminders and emails about the CARES Act virtual training conference that's hosted by HUD. We really want to turn your attention to an ESG-CV monitoring workshop that is going to be held during this conference. It's going to be on Monday, and the workshop is from 12:45 to 1:45 Central Standard Time. And you do need to register for this webinar to get details on how to log in for the workshop, so make sure you do that. Also, if you have any specific questions about ESG-CV monitoring, you can definitely submit those questions on the monitoring workshop overview page prior to the event. All right, and then there is going to be next week a House America webinar on January 25th. And what House America is, it's a federal initiative where HUD and USICH have pulled together the mayors and county leaders and tribal nation leaders and governors into a national partnership on how can we use these historic investments into our community. And so there's going to be an update on this effort on January 25th. And then NAEH, the Unsheltered Homelessness Conference, scheduled in February, is now virtual, which is really exciting for those of you who were not able to register back in November when the conference was first announced. Because it is now virtual, definitely register. It's still, there's a registration fee, but it's much cheaper than had you attended in person. And then finally, we have the National Healthcare for the Homeless Conference in May. That was just announced. So please go to their website to learn more about that conference. I do have a few resource updates. The latest one, coordinating ESG-CV and EHV to create surge capacity and coordinated entry. That was just published and is on the HUD Exchange for you to download. This document essentially just focuses on how you can create surge capacity, like for example, a housing fair in your coordinated entry system, so you can expedite referrals and lease up EHVs and other resources such as home ARP. And then another exciting resource that was just announced. It's posted on the US ICH website, and it's about the Omicron variant of COVID and what homeless service providers need to know. And this was a document that was pulled together by USICH, CDC, HUD, the VA, and one of the main takeaways that you should know from that resource is that unlike the 5-day isolation and quarantine period that the CDC recommends for the general population, the CDC recommends a 10-day isolation and quarantine period for people experiencing homelessness, regardless of their vaccination status. So I encourage you to go to that link and download that resource for more information. And then finally, NAEH did just publish a tool earlier this week. It's an interactive tool, which is always cool to use. It's about how to, they want communities to revisit their ERA and EHV strategies to recognize the potential of how you can fully take advantage of this funding. So it's an interactive tool where you can enter in information about your community and see how, the strategies that you're doing, how it could impact the homelessness count. So for today's agenda, we are going to be spending the first part of our training talking about COVID testing opportunities. We're going to be talking about how to access those free tests, what the data collection requirements are, what are some eligible ESG-CV costs for testing, and some best practices for testing in shelters. And then after, we're going to transition over to talk about spend down strategies for ESG-CV. And we're going to hear from Maine and Kansas, who are our all-stars for spending for ESG-CV. These folks are the top of the top spenders for ESG-CV. And so we're really excited to have them on today so they can share their knowledge about how they're doing what they're doing. So with that, I'm going to turn it over to Melanie to talk about COVID testing opportunities for ESG-CV.
Thank you very much, Natalie, and hello, everyone. I'm glad to be here. I just started a paper printing, so I hope that, okay, it stopped. Thank you for introducing what I'm going to talk about as well. So the questions about accessing free tests, the information about accessing free tests, especially during this surge, is changing all the time. So I'm going to be really careful about what information I provide here. And then we are happy to give updates as more information comes in. As always, as the C19 or the COVID-19 team has done pandemic to date, we urge all communities to connect with local or state public health and healthcare for the homeless agencies in their communities first. And that pertains also to accessing free tests. We just know that those are the organizations that are always connected to testing resources, testing strategies, anything COVID related. And if our homeless service systems can link into those systems, that is the best practice, to just rely on those partners. We also acknowledge that in some communities, those partnerships are still very strong, whether they were stood up for COVID or were existing beforehand. And in other communities, they have sort of waned away. So the more you can encourage communities that you're working with to maintain those relationships or kind of re-energize those relationships while we continue to go through these surges, the better. Even if those relationships don't come to fruition for the communities you're working with, though, there are some federal resources. So we'll go through those. So whoever's changing slides just changed it at the perfect time. I just hadn't said, please change the slide. So The resource that we know best from the COVID-19 team is the CDC. So Operation Expanded Testing is probably the most tried and true at this point federal resource for communities to have access to testing resources beyond what might be already in existence in their state or local areas. So I included the website link to Operation Expanded Testing. It's a nice website with a lot of Q&As right on the cover page of it, so you can get a lot of answers really immediately. But things that we wanted to pull out and share is that this is a way to get free facility-based tests and testing advice, testing guidance, including in congregate settings. So as you look through the website, it sort of looks more geared towards schools, but homeless service providing agencies of all kinds can actually fit into this service as well. It's a free service offered by CDC. And how they've set it up is that there are 3 testing hubs throughout the country. So if you're interested in getting testing, having them do the testing results, you need to get in touch with your regional testing hub. There's like a west, middle of the country, and an east testing hub. They're easy to find. The contact information on the CDC website. What an agency would do is send in a form letter that's on the page. The agency staff would be trained to conduct the testing. It's PCR testing, so the nasal swab testing, and then there are clear instructions given about how to send those tests in to the lab. What CDC is saying is that results will come in 24 to 48 hours, and then it says up to 72 hours. So I think it's 24 to 72 hours that the results will come back. So it's still new. I think it's the most prominent one out there right now as far as a federal resource, but it's still new. So if there are things that you notice that you want to share with us as the C19 team so we can share with others, please do it if your communities are using that CDC option. HRSA has an even newer way for communities to access tests. So how they've set things up through HHS and DOD is that HRSA supported health centers. So these are going to be FQHCs, or healthcare for the homeless agencies, Medicare certified rural health clinics. In your communities, those agencies and clinics will know who they are, but they can apply to HRSA to get self-tests. Also a free resource. We haven't seen this in working motion as much as we've seen the CDC resource, but this is something that's out there now. The website also looks really nice and pretty user-friendly for how to access the HRSA resources. And then finally, thank you, FEMA has been getting requests for diagnostic tests. So not for surveillance tests, only for diagnostic tests. We are just hearing about this week, really, maybe later last week. But FEMA is doing some things as far as getting tests out communities. That's all we have to share. We felt like it was worth noting as information is changing so quickly and developing so quickly. So we're happy to give more information about that as it comes. And then I'm pretty sure there are ESG-CV funding experts on this call that know way more than me about ESG-CV funding, eligible costs, and data collection. But as far as data collection around vaccine-related events, testing events, getting tests, all of those things, what we have learned from our data collection experts is that is the statement here. So client level HMIS data collection is not required for events related to testing. and not just events, activities related to testing. But in quarterly reporting, you would report when you're doing that, and you would report on the expenditures more broadly and include a narrative that would talk about what those activities were for that expenditure. I know that's a short answer. So if I can be helpful in getting more detailed answers as people have questions, I'm happy to do that. One side question that came in was whether COVID tests purchased under ESG essential services would be under the outpatient medical services. And the answer that came on last week's HUD SNAP's office hours is that yes, they would go under outpatient medical services. And we have that verbiage if somebody needs that to show some verification of that. So that's data collection. And then the ESG-CV eligible costs. So this is, I just thought I would hold this up. I think everyone has seen this. It should be in portrait mode, but printed this way. So this is the guidance that we've had for quite a while. This has not changed, and it goes through emergency shelter, including temporary emergency shelters, essential services, street outreach, overhead costs, expanding staffing and training, and then HMIS costs. So all of that guidance is the same. Our tone from our HUD partners at the federal level is that they want us to get testing and vaccinations and all of those things to the people that we're working with. And there are some really broad categories that a lot of costs can fit in under ESG-CV. So that guidance remains the same, and there has not been additional guidance developed to this point. So testing in shelters, and I'm going to broaden this out a little bit and include testing on the streets and in other settings where people who are homeless congregate, maybe meal sites, that kind of thing. We know that testing strategies and vaccine strategies now are very local. There's, in the beginning of the pandemic, we could sort of give broad guidance for a lot of things that sort of applied to all sorts of different types of agencies and places where people are. That's just not the case anymore. So testing really it really depends on resources in the agency and in the community, supplies they can get, which hopefully we've given you a couple of new places to look for supplies, agency structures, policies, politics, as well as policies, all of those things. So this reiterates the point about leaning on public health departments and healthcare for the homeless to help you navigate testing in shelters, on the streets, and other settings from a very local perspective. We know now that during surges, such as the one we're experiencing now, that weekly testing in shelters is best practice. We have also heard very clearly, and I do work here in Salt Lake City locally, I know this firsthand, that an orderly weekly testing of an entire facility at this point is not realistic. Agencies and COCs are overwhelmed at this point. There is so much Omicron and whatever other variants throughout the populations that weekly testing in that sort of methodical way is just not the main thing that is happening. So we know that those things are not necessarily feasible. So some communities have done things like reverted to symptom screening or symptom dividing of people. So if they come into a shelter, if you are symptomatic, you go into this dorm. If you are not symptomatic, you go into this dorm. But even right now in this Omicron moment, we know that even that is not a perfect way to keep people safe. There is a product that we're really excited about that includes information on isolation in place. We're not excited about isolating in place. We're excited about having a product to help people understand how to isolate communities in place or groups of people in shelters. So that we expect that to be published hopefully this week. And that will be a good thing to share with communities, because although it's not a great thing to think about isolating people in place in shelters, it's a reality in a lot of places, and they're doing it. And you know, the questions are coming up about if this percentage of the population is symptomatic and they're in the big dorm, and this percentage is not symptomatic and they're in the small dorm, at what point do we switch those dorms to be one isolation and one non-isolation? How do we keep everybody safe and in a clear place where they should be? So that's coming, and we will make sure that we have links going out to people. So those are the updates that I have to share, the little sparkly rainbow dust to share with all of you on this call, because it's not the lightest content. We're not in a light and airy place, as you know. I'm happy to answer questions. I have a couple people who are backing me up on questions as well. So we may answer throughout the rest of the presentations. And thanks very much for having me.
All right, thank you, Melanie. Really appreciate you sprinkling some of that sparkles of information for us during such a dark time. We are going to do our best to answer your questions that you're putting in the chat and in the Q&A. If we aren't able to give you an accurate answer, we are going to follow up with you all with some responses to your questions when we send out the materials and recording for this webinar. And with that, we'll turn it over to Kansas, Mr. Doug Wallace. He's going to talk about Kansas effort and strategies for spending down their ESG-CV funds. They are one of our all-stars for spending ESG. I think they've spent over 60% of their ESG-CV allocation. So kudos to you and your team. I'm going to turn it over to you so you can share some of your strategies.
All right, well, thank you. And thank you for such a great introduction. I am Doug Wallace. I work with Kansas Housing Resources Corporation as their program manager for the ESG program. And I have to be honest right up front that I've only been with KHRC as the ESG program manager for a short time. So a lot of these strategies, a lot of the structure was put in place before I came on board, but I get the pleasure of talking about some of them. So KHRC, we are the recipient for the ESG funds that come to Kansas for our non-entitlement communities, which in Kansas is just about all of our communities except for maybe 3 larger cities. So covers most of the state, including a lot of rural communities. And as you know, rural communities don't always have a lot of resources available to them. And most years, our ESG award is right around 1.6 million. And I'm sure like other states, when we received our ESG-CV funds, that jumped up significantly. It went up to almost 15 million. So KHRC had to do some strategic thinking of how are we going to spend down these funds. Just kind of give some background about how we do our awards. KHRC awards our ESG funding through a competitive RFP process. So we put out a notice that the funds are available and agencies submit bids for that funding. One thing we do, I don't know if it's unique from other states, but we work with units of government, local municipalities, so that the agencies who are interested in bidding for the ESG funds, they submit those bids to the local government who then submits an application packet to us, and then we award the funds to those units of government or to the municipalities. So they are our subrecipients. The benefit of that is those subrecipient agencies help us provide some oversight on expenditures. So an example is city office will submit a funding packet to us for multiple agencies within their community who carry out the activities of ESG. And then the funding requests go through that city office, and then the city office would help with ensuring that they're spending down their funding allocation. With our ESG-CV funds, we followed that same process. So when the funding became available, we put out a notice that the funding was available and received bids for that funding. We use that as an opportunity to solicit bids from our current ESG providers, but also looked at some non-traditional providers. So one of the things that we did was we now have 7 community mental health centers who are they're nonprofit centers who provide mental health treatment to people who have a severe mental illness. We now have 7 of those CMHCs who are providing ESG related activities. And we brought on 2 organizations who provide statewide services. So this has led us to expand our services to areas that were not historically covered with ESG funds. It allowed us to bring on some new innovative projects. And a couple of the projects I want to highlight, and then I'll turn it over to Travis to talk about kind of some of our strategies. One of our CMHCs is using the ESG funds to support a mobile shower trailer. So it's mobile shower with laundry trailer that they use for street outreach. And so the ESG funds are part of that project. And it's actually part of a larger partnership within the city that also includes outreach teams from the homeless shelter, outreach teams from the police department, and the health department. So the laundry shower trailer is part of 3 trailers. The other trailer is going to be a food bank, clothing bank, and then the health department will be doing some health screenings. So kind of a cool use of the funding to support that project. ESG funds also were used for hotel vouchers in areas that are not served by homeless shelters. So I was able to expand that resource to a lot of our rural communities. So with that, I'm going to turn this over to Travis. Let Travis talk a little bit more about our strategies.
Yes, thank you, Doug, and great job explaining some of the non-traditional routes that we have gone through to help spend some of the funds. Some of the traditional things that we do with our standard ESG grant, but that we've also expanded into with the CARES grant, is we typically only award a 1-year grant, knowing that our grant period is longer than that. That way the agencies know that they have a specified time frame to try to spend down those funds. And then that also gives us an opportunity to award extensions to those agencies. Typically 3 months is what we'll do if they're close, and it gives them a little bit of a buffer to expend those funds. Another piece that we do, I'm the fiscal monitor for Kansas Housing Resources Corporation. So one of the things we do is our finance department develops a report that's monthly, sends it out to us, and then me, Doug, and our division director, Christine Reimler, who's on the call as well, will review those balances, those expenditures, to see how the agencies are doing in spending those funds. That allows us an opportunity to see those that are doing a great job spending those funds, or those agencies that are struggling spending those funds. And so what we'll do is Doug will reach out to those agencies and say, either way, we notice, hey, that you guys are doing really well in spending your funds. Would you like some additional money, or would you be receptive to getting some additional money? Or like I said, the other way around, if those agencies are having difficulty, we can have conversations with them and see if they're, maybe something came up and they're just not able to spend the money down like they had originally intended. And so that allows us to do budget revisions and requests throughout the program year, and shifting those funds from, one agency to another, depending on how those agencies are doing. The one thing we do stress to those agencies is that if they do have difficulties spending down the funds and they do feel like they need to give some of that money back, we really stress to them that it's not going to be punitive. We understand situations happen, and that, we will definitely look to them in the future to see if there's, a way that they can help out spending down for future monies that we receive. So that's really the breakdown of what we do internally. I would just say it's mostly just a lot of communication with those agencies, constantly seeing how they're doing, making sure that they have everything that they need from us to allow them, to the best of their abilities, to spend those funds down. Doug, did you have anything additional to add to that, or?
No, I think just, I guess one thing I would add is related to that communication is just having a good relationship with those agencies so that they feel comfortable reaching out to us with questions or requests, or to ask for budget revisions or to get back those funds. I think one of the keys is working with them and having that relationship with them.
And that understanding that that we're partners in this, and that we don't look to, want them to have anything reflect negatively on them.
That's great. I have a question. So it sounds like it's pretty dynamic. You're moving funds pretty consistently between providers. Do you also do like a contract amendment, or how does that work when you're moving funds?
Yes, so that is a piece of it, is we do require them to, if they feel like they need to give money back, or if we're going to give some additional money, we do require a budget revision. And then, yes, we will update the contract, a revised contract, and have all parties sign reflecting those changes. And like you said, well, it is dynamic. It's not, like every day kind of thing. We definitely try to limit how much we do it, because, there can be issues that can arise from moving money around. But like I said, it's mostly, we do try to have budget revisions. We definitely have a process in place when those things are needed.
Great.
Thank you, Natalie. That was a great question.
Thank you. I know that some communities, it's a real bear to move those funds, and it's not a very fluid process. So it's really helpful to hear that, you're looking at your financials monthly and reaching out and having that kind of ongoing communication with your subrecipients. Just out of curiosity, how many subrecipients do you have for your ESG-CV funds? Do you have an idea?
I really should know that, and I'm drawing a blank right this minute.
That's okay if you don't know.
I know it's more than 20, I believe, correct?
Yeah,
Okay.
it's more than 20.
That's quite a few.
And like Doug said, I would say the big piece as to where we differentiated a little bit with CARES money is typically we do only award the monies to municipalities to limit the risk. For CARES money, obviously we still look at risk, obviously, but we did do some direct assistance to agencies instead of to counties and municipalities. But generally, we just try to do counties and municipalities if we can.
Nice. Okay, fantastic. Thank you so much. If anyone has any questions, I can provide some email addresses when we send out the materials and the recording for the program. And obviously, always feel free to put your questions in the chat and Q&A, and they can answer them. All right, thank you
I'm
again.
just
Oh, yes.
looking, it looks like we have 27 agencies currently that
27. Okay, well, that's quite a few. That's a lot of agencies to monitor and track. So kudos to you all for being able to do that. All right. So next we're going to move on to Maine, who also is one of our all-stars for ESG-CV spending. They're also have spent over 60% of their funds. Welcome. We have Mike Shaughnessy here, who's going to tell you a little bit about how they're able to do what they do.
All right. Hi, everybody. Thanks for having me. Excuse my voice, and if I cough a little bit, I'm getting over a cold. Not COVID, just a cold. Those do still exist out there. So excuse me if I have to pause for water or something. But so just to give some background to start, Maine is a little bit unique. We have a single statewide COC, meaning not just a balance of state. It means every part of the state is covered by a single COC. And Maine Housing is the recipient for statewide ESG funds. We're also the HMIS lead agency, and we're the collaborative applicant for the COC. We're the management entity for coordinated entries. So that does give us some existing structural advantages to being able to implement programs quickly, which has helped in our spending down. So that kind of put us a half step ahead. So before COVID, we had used ESG funds under emergency shelter and housing stabilization to fund 24 partner agencies, 37 different shelters across the state. So that gave us an existing network of partner agencies to work with as we looked at strategies to spend down these funds. So we can jump to the next slide. So what we did is we put out a few different programs. We put together homeless provider grants, and I'll explain what each of these are in subsequent slides, but we put together homeless provider grants that went to our existing agencies. And then we did a temporary rapid rehousing program. We then looked further into needs, and we decided to put together a COVID response diversion program. And finally, we did a shelter renovation and conversion program. And those all address needs that we found. So we can jump to the next slide. The first one I'll go over is the homeless provider grants, which we love acronyms in this field, so we call them HPGs. And it was funded under emergency shelter, and it went directly out to our existing shelter providers. And it was that straightforward thing, allowing them to cover any additional costs that were coming from operating during a pandemic. And obviously some of those were straightforward. It was buying the mask, buying the gloves, buying the hand sanitizer, buying the shower curtains to create dividers, all those things that our shelter providers are doing to allow them to operate. A big part of it went into hotel vouchers, are still going into for hotel vouchers to allow some of our more tightly packed congregate shelters to get more social distancing. We also used it for incentive pay for staff, testing and vaccination incentives for clients, all those things that are listed out in those waivers. We also gave the providers the latitude to take a look at the regs themselves and come to us with other more creative and interesting ways to spend down this funding. One of the ones that some of the shelters have come up with, which has been a great way to utilize this fund and to effectively keep people from being in high-risk situations, is a lot of our shelters have bought vans for transportation to keep them off of buses, to keep them out of cabs and Ubers where they're interacting with people in close quarters that aren't in their bubble, or being transported in staff vehicles, which then need to be sanitized. So we've also had one of our shelters has taken their case management spaces and converted them into quarantine spaces so that they're able to use them. And it's actually in another building, but they've converted it into shelter space. And they've done that under the HPG grant. So we can jump to the next one. So one thing we realized very quickly as we got into the pandemic is we have all these funding sources out there, which is great. We have the ESG-CV that we're using to, fund hotel rooms. We also have FEMA helping us pay for hotel rooms to do quarantine and isolation and to do emergency shelter. What we really quickly realized looking at the numbers was once we had this excess capacity, it was swiftly filled. And once that time limited funding ran out, which we initially thought was going to be last September for the FEMA funds, and that's kind of extended out, but those are time limited funds, and the time's going to come when that's going to stop. And we needed to implement a strategy to try to depopulate to the point where once those time limited resources went away, we wouldn't be faced with a cliff of a large number of people suddenly losing their shelter and putting a strain on the local homeless service response system. So we implemented a TRRP program, temporary rapid rehousing program. And we looked at the agencies across the state that had their communities were using hotel rooms at the highest rate. And we worked with them to implement a core of staff and a core of case management professionals who could work them through rapid rehousing solutions to try to get as many people out of these hotels as quickly as possible, so that once this time limited funding came to an end, we wouldn't be facing this cliff. And that's something where we said we determined the need based on the number of people that were in hotels in that community. We apportion the money and we just do quarterly reporting on that. So they have the flexibility to use the funds they need to, and it's available to them. They're not going through a reimbursement process as they, spend funds on direct client costs. They just have to be accountable to it every quarter. We can jump to the next slide. And then the next thing we were talking about, you'll notice the theme, we keep analyzing what's going on. We're looking at the data. We're looking at what holes we can plug or what we can do to alleviate strain on the system. I know this is something that's happening throughout the country. It's particularly difficult in Maine, is that placing clients into permanent housing has become a real challenge during COVID. It was a significant challenge in Maine prior to that. We have a very low vacancy rate on a normal day. During COVID, it's extremely low. We have relatively high housing costs for our income base. So it's always been a struggle, but it's become nearly impossible during the pandemic. So there's a significant strain because there is an outflow right now. The outflow is slowed to a trickle. And without the resource to create more housing for outflow, we looked at strategies to limit inflow, just so that we could relieve some strain. So we looked at contracting with a consultant. We brought a consultant in that would do rapid resolution training. We had 15 of our 24 agencies sign on to do rapid resolution training. And then we implemented, and this was geographically spread throughout the state, we were able to implement diversion programs throughout the state so that we could limit the inflow to kind of put some relief of the strain from the system. And that was provided, they were able to use that funding for for staffing costs, obviously. And then if you dig into the regs, there's a number of eligible direct client costs you can use that for as well. So they've been able to use that. And similar to the TRRP program, that's been given as a grant that has quarterly reporting. So they have the funds available, they're flexible within the regs so that they can use them, and then they report to us on a quarterly basis. We can go to the next slide. So obviously we've been talking about social distancing in congregate shelters. Maine shelters lost about 20% of our bed capacity once COVID hit, because our largest shelters are by far the most densely packed. Our largest shelter is in the city of Portland, and it was housing 229 people in a 3-story Victorian house. It was a 1.5 foot spacing between mats. So they had to significantly reduce their bed capacity, as did a lot of other shelters. So we looked at what we could do for that. And we said, we can use this to renovate and convert existing buildings to make more shelter space. And obviously we looked at Portland, which is our biggest city, which may be a stretch. It's a 67,000 person city, but it's the biggest one we have in Maine. We looked at Portland. We found an agency that had an existing space, and this was through a competitive RFP process, but we were looking at the need, and there was an agency in Portland that could do it. There was also an agency in a rural underserved community that was willing to do a shelter. So we were able to get that funding out and start the conversion process, which is mostly finished now. We're going to be opening the first one, I think, next month. And this was a project that was really great for us as a housing authority, because we are also the state's largest affordable housing developer. So we were able to partner with our development team to really speed this process along and get this project out the door, because we have people who are really good at project development and project management. So it really allowed us as a housing authority and as a housing developer to really collaborate with our partner agencies to get this money out the door and get this resource on the ground. So these are kind of the programs that we've put in place, but they really reflect the overall strategies that we've been looking at as a state. First and foremost, it was just to rapidly deploy the funds that we had to meet our existing providers' needs. We had an existing network of providers, and we put those funds out as quickly as possible. And as we went through, obviously we have had quite some time in the pandemic now, so we've had, a time to refine the system. Initially, we were doing them as each request was an individual grant that we would do a grant agreement for. That allowed us to see what agencies were going to spend, what rate they were going to spend through money. And then once we got to the end of 2020, we were able to just convert that to an annual grant that kind of reflected how quickly people were going through money. And then we were able to just have that become a monthly reimbursement off of the overall grant. As we've gone along, we have, as Kansas has found, sometimes the spend rate doesn't stay consistent. And we've had agencies come to us and say, we're not going to be able to spend through this. And we've said, okay, we can reallocate this if you really think you don't need it. And we've looked at some of the other agencies and said, what can you do with this money? And they've been able to come up with some of the more creative ways to use it. And then we reallocate it from one agency to the other. The other thing is just finding those existing gaps in the homeless response system. So here in Maine, we didn't have any federally or state funded diversion or prevention programs. And that was a gap that we knew we had. It's one that we were working on pre-COVID to try to find strategies. But with this funding and with it becoming a significantly larger problem because of the pandemic, we chose to use the CV funds to fill that gap. And then that's going, hopefully this is a gap that we've filled and we can extend these programs beyond COVID, because now we have the data to show that this works, and we have the ability to say diversion works, and it's a more cost-effective way to respond to homelessness. And then we looked at where were the shortfalls from the pandemic. We lost beds. How can we recover beds? And that was renovation and conversion. And then looking beyond the pandemic, we realized we're in the pandemic now, but someday it's going to end and things are going to go back to some semblance of normal. And how do we bridge the gap between the crisis we're in now and the time after that? And that's that temporary rapid rehousing program that we wanted to make sure that we were ready to step beyond the pandemic. And then I think the most important one, and I heard Kansas say this as well, and it's really a key part, is we are constantly engaging our partner agencies on ways to utilize the funding, especially when we get into when we're talking about, well, really all of them, except for the renovation and conversion. We have very smart people out there in the field who know how to read a reg. And I constantly am getting emails asking me, would this be an eligible cost? Would this be an eligible cost? And then I say, well, how does this relate to the pandemic? How do you feel this works? And we'll have a conversation about it. And they have come up with some great solutions, but it's on my other screen right here. I've got 4 emails since I started talking about how can I spend down this money? And it leads to some great solutions, and it leads to us being able to effectively serve the people we need to serve.
Thanks, Mike. Yeah, similar in my experience as well. I think just scheduling those separate meetings with some of the partner agencies to do some brainstorming, to talk about, how you can spend those funds, because I think, we all know the regs fairly well. We know how to read a reg. We've been on all the webinars. We see examples of best practices, but still, I think, we tend to think about the same things. And so it's nice to have other people there who always have new and different ideas that maybe we haven't thought about. Do you proactively reach out to your partner agencies if you see they're low on spending to talk through some ways to increase their spending?
We absolutely do. So I'm the program manager, so I do program implementation. My counterpart is the operations manager. She's in charge of the money. And while I'm working on programs for the providers, she'll be tracking the spend down rates. And if an agency is a little slow, she reaches out and proposes. She interfaces with me and comes up with some ideas, says, this is what your spend down rate is. Do you need ideas of what to do? Then I'll reach out as a follow-up. Or we have agencies that are similar. They work in similar environments, they're similar sizes, they have similar demographics, and we'll suggest they reach out to another agency who's doing more creative spend downs and say, why don't you talk to Preble Street about this, because they're doing a really great job of finding ways to better serve their clients with this fund.
Excellent. So you're connecting them with each other as well. I think one thing I've taken away is how close that programs need to work with finance to manage these funds. Sometimes I think finance is a little bit more isolated and working in their own department, churning out their reports and paying those invoices. But the more that invoice or more that finance and program teams can meet and communicate on a fairly frequent basis to address ESG-CV, I think is very impactful.
We actually, during the pandemic, we have a finance department at Maine Housing, and we went out and poached one of their staff to work with us during the pandemic and really drill down, because we have to have someone right there with us virtually, because we're all working from home, but within the department to constantly have feedback into spend down rates and who's ahead, who's behind, and that type of thing.
Right. Excellent. All right. Thank you, Mike. We haven't received much in the way of questions in the chat or the Q&A, but if you do have those, please put those in. We do have a couple of extra minutes. We have 7 minutes remaining in today's office hours to answer any questions that you have, either related to testing or, in response to some of the information we've heard from Kansas and Maine today, or on other topics related to ESG-CV. If we are not able to answer, obviously, we'll get back to you after we do some research of our own. So I'll leave it open for just a minute or so folks can ask their questions before we close out for today.
I was going to see if I could ask Mike a quick question. How do you know on average how much the cost of the renovation and conversion programs were that you did?
So we had put, it was essentially what we had left in the CV2, and we put 2.2 million into it, and we put it out to RFP. We got one came in at 800,000, and then one came in at 1.6, and then we only got 2 bids on it, so we were actually able to just grant out the full amount of money. We were able to grant the full 800,000, and then we were able to do 1.3 of the 1.6 from the other proposal.
Okay, thank you.
And those were both existing spaces that the agencies had. It wasn't acquisition or building, it was conversion.
Mike, could you give a little more context about the mechanics of how you operationalize the block grant funds?
Sure. So there were a couple different ways. So the HPGs are they're not block granted. They're monthly reimbursement. So they send in essentially an invoice with supporting documentation, and then we send out reimbursement. The other programs we allocated based on the number of clients they were serving. We looked at the overall budget and said, this is the amount of money we're allocating towards this program. We looked at how many people were in hotels in that community, did some simple math, came up with a grant for each of them. They would be advanced those funds, and then they have to report on that on a quarterly basis. They have to report on it on a quarterly basis, but they end up reporting on it much more often because they don't want to misspend the funding. So they end up sending us their ledgers and sending us their backup documentation pretty frequently. But there is a summary report that they have to do at the end of the quarter. And then we have financial monitors who go through and make sure that all the costs are eligible.
And is advancing funds something that your state had done previously, or is that new to our COVID times?
It's something we had done on occasion, but it's not something we had done frequently. It was the extent to which we did this was pretty new.
Thanks.
Great questions. All right, well, we are going to end today's office hours. I want to thank our presenters again for sharing some of their knowledge regarding ESG-CV. And in the next couple of days, I will be sending out a copy of the materials and recording along with the email addresses of today's presenters, should you have any questions that you would like some more information on regarding today's presentation. So once again, thank you, everybody, and I hope you have a wonderful rest of the week.